It was just after midnight when Mercy General Hospital's emergency room was overflowing with patients.
Ambulances arrived every few minutes, doctors rushed from one trauma bay to another, and exhausted nurses barely had time to catch their breath. Among them was Emily Carter, a rookie emergency room nurse on only her third week of independent duty. Although she lacked experience, she made up for it with quiet determination and genuine compassion.
That night seemed like every other busy shift. Until the front doors burst open.
A masked man carrying a handgun rushed into the emergency department shouting for everyone to stay where they were.
Panic swept through the waiting room. Families screamed, visitors dropped to the floor, and medical staff instinctively moved patients behind beds and equipment.
The emergency room suddenly became silent except for the sound of frightened breathing and the man's angry voice. He demanded immediate treatment for his injured brother, who had been brought in moments earlier after being caught in a violent confrontation outside the hospital. Most people froze in fear, but Emily remained remarkably calm. Without making sudden movements or challenging the gunman, she slowly stepped toward the frightened patients closest to her, quietly encouraging them to stay low and remain calm. Speaking with a steady voice, she assured the gunman that everyone in the emergency department wanted the same thing: to save his brother's life. She explained that the trauma team was already treating him and that every second spent arguing only delayed the care he desperately needed. Her calm words slowly lowered the tension inside the room. Unknown to the gunman, another patient sitting quietly in the corner of the emergency department was Commander James Walker, a decorated Navy SEAL officer recovering from a minor training injury. He had been waiting for X-ray results when the crisis began. Rather than acting immediately, he carefully watched Emily's actions. Years of special operations had taught him that courage was not measured by aggression but by the ability to remain calm under extreme pressure.
Emily wasn't trying to be a hero.
She was simply protecting lives. As hospital security discreetly alerted law enforcement, Emily noticed that the gunman's breathing was becoming faster and his hands were beginning to shake. She realized he wasn't acting like a hardened criminal but like a desperate man terrified of losing his younger brother.
She gently asked him his brother's name.
Surprised by the question, he answered quietly.
Emily smiled reassuringly and promised that the trauma surgeons were doing everything possible to save him. For the first time since entering the hospital, the gunman lowered his weapon slightly. That small moment changed everything. Commander Walker recognized the opportunity immediately. Without unnecessary violence, he quietly coordinated with arriving police officers positioned outside the emergency entrance. As the gunman focused on Emily's reassuring voice, trained negotiators entered the room.
Realizing his brother was receiving medical care and that no one intended to harm him, the man slowly placed the weapon on the floor and surrendered peacefully. Not a single shot had been fired, and no innocent person had been injured. The emergency room erupted in relief. Parents hugged their children, nurses comforted frightened patients, and police officers thanked the medical staff for their extraordinary composure.
Commander Walker approached Emily before leaving the hospital.
Looking her directly in the eyes, he said, "I've served in combat for over 20 years.
Tonight, the bravest person in this building wasn't wearing a military uniform, it was wearing hospital scrubs."
Emily smiled modestly, insisting she had only done what every nurse is trained to do:
protect patients. Weeks later, the hospital honored Emily for her professionalism, compassion, and ability to remain calm during a life-threatening emergency.
Commander Walker was invited to speak at the ceremony, where he reminded everyone that real courage isn't always loud. Sometimes courage is a calm voice that prevents panic, a steady hand that comforts frightened strangers, and a compassionate heart that chooses empathy over fear. Emily returned to work the very next day, caring for patients just as she always had.
Most visitors never realized that the quiet young nurse checking their blood pressure had once helped save an entire emergency room without firing a single shot.
Her story became a lasting reminder that true heroes often wear simple uniforms and quietly change lives through courage, kindness, and selfless service.